My name is Lynn Simpson. I'm Chief of Obstetrics at New-York-Presbyterian, Morgan Stanley Children's Hospital. I'm a specialist in maternal fetal medicine, and that's someone who's already trained in obstetrics and gynecology that's done additional training in high-risk obstetrics. So we look after mothers with serious medical conditions, maybe critical care obstetrical conditions, as well as women who are carrying babies that have been associated or have abnormal development, structural malformations, perhaps complicated twin pregnancies, or even a baby that's carrying a genetic syndrome. At the New York-Presbyterian Hospital, Morgan Stanley Children's Hospital, there's lots of research being done in maternal conditions, things like hypertension, placental disorders that might lead to poor fetal growth, why some of these conditions occur, and some of the complications occur related to these conditions. There's a great deal of emphasis on reproductive genetics, as well as trying to identify fetuses that carry some of these genetic syndromes or abnormalities of their genetic makeup. Some of the new innovations in maternal fetal medicine are related to treatment of the fetus before delivery. I would say probably the most recent innovation in this field has been the introduction of laser photocoagulation for the treatment of twin-twin transfusion syndrome. We're one of the few centers in New York State, and certainly the only center here in Manhattan that offers this treatment. And it's a treatment that can really improve the prognosis for twins when this complicates their pregnancy. It's really a very fascinating procedure. When the diagnosis of advanced twin-twin transfusion is made, a little fetoscope is introduced into the uterus under ultrasound guidance, and you can actually visualize the placenta and some of these abnormal connections within that placenta and coagulate them with the laser. And that's been shown to really improve the survival and improve the neurologic outcome of these identical twins with this complication. We use a team approach for almost all the care that we provide to high-risk women, both for the maternal conditions that they might have, obstetrical complications like placenta previa, placenta accreta, as well as the fetal conditions. Probably the best model of the team approach that we use here is here in the Center for Prenatal Pediatrics, the Carmen and John Thain Center, where a multidisciplinary approach is really utilized on a day-to-day basis, looking after women that have been recently diagnosed with a fetus with a major malformation or a genetic syndrome, or again, a complicated twin pregnancy. And patients get referred here, or sometimes are self-referred here after doing their homework on the web, and they will come in, and we really try to give them all of the services they need on 1 or 2 days so they can gather the information to help them understand what's going on with their pregnancy, help them make decisions about their pregnancy, and hopefully enable them to improve the prognosis and the outcome for their pregnancy by delivering here with us.